Hello everybody, this is Dr. Aaron Seaton with the Chiropractic Place, and today's video is about how to prevent low back pain. This is something that I see in the office. It's very common in chiropractic offices, so this is a good topic for us to help patients prevent these flare-ups from happening. So the first and foremost that I like to talk to my patients about, obviously not during some major flare-up, but we talk about these concepts to help prevent those flare-ups from ever happening again. And the big one there is building core strength, learning exercises that you can do consistently throughout your week to build your core strength. Your core stabilizes your low back and protects it. So it's very important to have a stronger core if our goal is to prevent low back pain. Second thing, making sure we're using proper lifting or proper reaching, bending. We have to pay attention because there are things that are bad for our back, and constantly reaching over or bending over like this all of the time. When we do that, we take a lot of the weight of our body off of the joints that are designed to hold it, and we kind of put that, especially in the low back, on the discs in the low back, and that can irritate the discs, cause pain, cause inflammation in these areas. So being aware of when we're lifting stuff, using our butt, using our legs to lift things while keeping our core strong. That's how we want to lift stuff. So be aware of that. If you have a job that requires repetitive lifting, we want to make sure. And this right here will definitely help with that as well. Number 3 is move more, sit less. If you have a job that requires you to be at a desk, trying to find a sit-stand option might be good for you, because when we sit, we increase the load on our low back by 50%. So that low back is having to work 50% harder, and we're doing something, we're not moving. And the joints in our spine love movement. That movement helps get nutrition in, get waste products out. So when we sit, we're not moving, and that spine, the low back, is having to work 50% harder. So a sit-stand desk allows you to be up at your desk, and hopefully you can be kind of moving a little side to side, incorporate into some basic motions throughout your day. It doesn't mean you have to stand all day. It just means we're not sitting for 8 hours. We're trying to break that up and incorporate some movement while we're at the desk. Very important. Number 4, this is a big one. Our spine, especially the low back, is a weight-bearing joint. So the heavier you are, the more weight that spine has to carry. So if you need to lose weight, if your doctor's told you, hey, you're a little overweight, or you notice that yourself, that's something definitely to work on, because it will improve low back pain, knee pain, hip pain, you name it. But specifically related to this video, it will definitely help with your low back pain if you start losing weight. And number 5, getting chiropractic care. This is among the most successful things you could do to help with low back pain. And in our office, the great thing there is that we take digital x-rays so we can see your spine and help educate you about your particular needs for your low back, and then build a game plan around that, and hopefully incorporate some of this to help decrease and prevent low back pain in your future. I'm Dr. Aaron Seaton with the Chiropractic Place.